Good evening and welcome to our COVID-19 update. I am Ladi Akiridulwale. Here are the highlights of this hour. Mixed compliance to COVID-19 protocols in north and southern Nigeria as Muslims mark Eid el Kabir. Preparations for schools' resumption for graduate classes reach peak as authorities decontaminate various premises. And Vietnam announces its first COVID-19 death as Prime Minister Boris Johnson of the United Kingdom puts further ease of lockdown on hold. We'll begin tonight with news that the Muslim faithful today joined their counterparts around the world to celebrate the Eid el Kabir festival, but many are celebrating without the usual pomp that accompanies the festivities because of COVID-19. Our correspondents take a look at how the Muslims in the southern states celebrated the day in spite of that pandemic.
Although this year's celebration is low-key in most states, the essence of the festivities is not lost in Muslim faithfuls in the southern part of the country. In Awka, the Anambra state capital, the faithful gather at these mosques in large numbers without observing social distancing. The mosque now filled to capacity, the faithfuls observe their prayers wearing face masks in line with one of the COVID-19 guidelines.
We send our appeal to Almighty Allah to bring the end of this pandemic for coronavirus.
In Osun State, worshippers also turned out for prayers. Amongst them is the state governor, Boyega Oyetola. The governor also has a word for the faithful as well as political office holders.
I want us to learn the lessons of today's celebration. It's a question of absolute faith to Almighty Allah. That when we promise, we must fulfill our promise. We must live in peace. I must remember those people are not as privileged as we are today.
The celebration in Ogun State is observed in absolute compliance with the directive of the state governor, Dr. Abiodun. Muslims shunned the prayer grounds across the state, with weeds taking over this prayer ground, which in normal times would have been filled with worshippers.
To follow the government recommendation is for our own sake, not for the government's sake.
It is not different in Lagos. Muslim faithfuls were not out to observe their Salah prayers, as religious gatherings above 20 persons are still banned in the state. But Governor Babajide Law visited patients at the labor ward at the Island Maternity Hospital.
We must all respect.
The Edo State Governor, Godwin Obaseki, used the occasion to play host to the Chief Imam of Benin, Abdul Fattah Ennabulele, and other Muslim leaders at the government house in Benin City, the state capital.
God wanted and wants a new beginning for us in Edo. That is why he brought someone like me who did not know and cannot accept the way they used to behave.
The Chief Imam praised the governor's leadership ahead of the governorship elections in the state.
People have witnessed absolute commitment, sincerity of purpose, honesty, respect for the rule of law.
The COVID-19 pandemic may have affected celebrations this year. It is expected that the prayers offered at this time would be of benefit as the nation continues to battle the health challenges. Victoria Idowu, Channels Television News.
Meanwhile, Muslim faithful across northern Nigeria also took part in the celebration, albeit in strict compliance with the COVID-19 protocols. Clerics at the Eid prayer grounds in many of the states preached peaceful coexistence and self-sacrifice, while governors and other political leaders urged citizens to pray for God's intervention over the rising security challenges in the region and other parts of the country.
Islamic faithful across Nigeria join others around the world to mark the 2020 Eid el Kabir celebration. While prayers were observed with strict compliance to the COVID-19 protocol, some other faithfuls shunned the advice. In Nasarawa State, north-central Nigeria, the governor used the occasion to instruct citizens on the need for peaceful coexistence in adherence to the safety protocols. His colleague in Kogi State speaks on the need to obey constituted authority.
This is also a very challenging period because of the pandemic coronavirus that has visited us. So this is the time for us to pray and to continue also to ensure that we practice all the various restrictions.
I encourage them to key into all the economic program of the federal government, starting from empowerment to various economic programs that the federal government, the state government has initiated. That is the only way we can see ourselves out of poverty.
From the north-central states to the far northeast and northwest, where the message of peaceful coexistence and self-sacrifice is echoed as strict compliance to health regulations is preached.
Yes, we have been tested by COVID-19. The economy has slowed down, but we have to work hard and assiduously towards making sure we provide the dividend of democracy.
I want to use this opportunity to thank the people of Jigawa State for observing the guidelines and the protocol for COVID-19, and thank Allah subhanahu wa ta'ala for protecting us and making this pandemic to reduce by day.
The governors of Katsina and Sokoto states and the Sultan of Sokoto, on their part, seek prayers to reduce the insecurity in the region, while the Deputy Speaker of the House of Representatives condemns all forms of sexual harassment.
For us as a Muslim, it's a day of reflection, a day of sacrifice, especially for those of us in Katsina and other trouble areas in the country, to pray more harder to Allah subhanahu wa ta'ala to help us to overcome this act of banditry, kidnapping, rape, armed robbery, and other associated crimes.
Eid el Kabir is one of the most important celebrations in the Islamic calendar. The occasion is usually a time to reflect on the tenets of sacrifice, love, and charity, especially now that the entire world is grappling with the coronavirus pandemic.
The Federal Ministry of Environment, in collaboration with the Ministry of Education, is embarking on decontamination of all unity colleges and examination centers across the country before the August 4 resumption date. Speaking at a press conference in Kaduna, the Minister of Environment, Mohammed Abubakar, says the exercise is to protect the health of learners and their caregivers at all educational levels. Mr. Abubakar says the decontamination exercise will start immediately after the salad break. Meanwhile, officials of the Ministry of Environment will ensure safety protocols for the containment of COVID-19 are adhered to at all examination centers.
This system will protect the health of learners and their caregivers at all educational levels, and as well as assure parents of the safety and well-being of their wards. Starting with the federal government colleges, those that we call the unity schools, and then some of the schools that host the senior certificate examinations, numbering about 19,000 nationwide. Whereas the unity schools will be subjected to thorough decontamination and disinfection in the coming days immediately after the Eid el Kabir Salah break, preparatory to their opening on 4th of August 2020. Our personnel will be mounting surveillance in some of these examination centers. This will include decontaminating of examination halls at the end of every examination session.
And in Taraba, students in the state's 305 schools writing external examinations this year have been asked to resume on the 4th of August 2020 for revision ahead of the WAEC examination date. This is part of the resolutions reached by education stakeholders meeting in Jalingo on ways to meet the set standards by the Presidential Task Force on COVID-19. 3rd of August has been earmarked for fumigation of all classes and hostels in the state which the government says will be monitored by a monitoring team put in place to ensure standards.
In view of the rate at which a virus, also known as COVID-19, is spreading worldwide and particularly in Nigeria,
Governor Darius Ishaku asking schools to shut down on the 24th of March 2020 in view of curtailing the spread of COVID-19 in the state. 4 months and still counting, the schools are under lock and key, with a pronouncement by the PTF for transition classes to reopen for external examinations. Education stakeholders in Taraba once again met to resolve on ways to meet the set standards, just as the state government gives express approval for the procurement of personal protective equipment in all schools.
All our schools should provide enough water, buckets, sanitizers in our school.
All health teachers in the state will, however, be trained on how to use thermometers and supplied with other PPEs.
We also agree that as much as we love our students, we must equally also protect their life. We should also protect their health and also that of the staff.
A visit to some of the schools in Jalingo shows that the school environment have been converted to farms by some teachers pending resumption of schools, while some portions of the school have been overtaken by weeds. This educationist is happy that schools will reopen for transition classes, but expresses worry over negligible acts by the school management.
Our schools, the principals, the headmasters, and the school management will take it upon themselves to ensure that everybody come to school with his mask, come to school with his sanitizer, follow the rules, do the correct thing, sit for the exams, and leave.
Salome Iliya is one of the students expected back in school on the 3rd of August. Despite spending 4 months at home, she looks forward to writing her exams.
We've been reading at home, hoping for the exams, but when it was first announced, our minister discouraged us by saying no, so I also relaxed. So now, recently learning that we are going to write the exams, I have to give myself more stress to go through my books and get ready for the exams.
For now, school administrators are awaiting government's provision of necessary personal protective equipment that will help them feel secured while performing their duties.
So much for schools decontamination. COVID-19 and its shelter-in-place orders brought a welcome relief in many places from air pollution and the worsening state of the environment. But did the longer trends of climate change, habitat destruction, and urban pollution play a role in COVID-19's appearance and spread? Some say that would be hard to prove, but there are some theories linking it. United Nations Environment Chief says nature is sending us a message with the coronavirus pandemic and the ongoing climate crisis. There have been different theories on the origins of the virus, but no matter how it happened, now that COVID-19 is here, researchers are seeing that its effects on people may be determined in part by the environment in which they live. They say those who live in more polluted environments, areas where there's more particulates in the air and more ozone smog, are more likely to have problems with underlying asthma or chronic lung conditions. I'm now being joined by Mr. Joseph Onoja, the Director of Technical Programs, the Nigerian Conservation Foundation. He joins us from Ajah in Lagos. Good evening, Mr. Onoja. Thank you for your time this evening.
Yeah, good evening, and thank you for having me.
The issue of environment, quite a number of people have said, what exactly does the environment have to do with COVID-19? Maybe in the first minute or two, could you spend some time dispelling the fact that there isn't a link between the two?
No, there is a serious link. I must tell you, there is a serious link between COVID-19 and the environment. In fact, what we need to realize as humans is the fact that the environment is our life support system. That's the first thing we need to know. And without the environment, we cannot survive. The environment does not need us. We are the ones who are relying on the environment. And as long as we continue to destroy the environment, we have a repercussion on our well-being. And yes, COVID-19 has a relationship with the environment and our well-being in general.
There is, of course, the fact that many people would say that what COVID-19 has done is to bring out some of the things that had already been in existence, but were not probably too well looked at. The question of waste disposal, how people treat sewage and all of that in the environment, and how that makes them susceptible to respiratory ailments like COVID-19. What can you tell us about that?
You see, the nature has placed itself for the service of man, but we have interrupted that. But even with our lifestyle, nature still does its work in trying to clean up the environment for us. For instance, the pollution that we're talking about, if we had more trees, these trees will be able to take care of the pollution. But on one hand, we are increasing the pollution and we are destroying the natural system in place to clean up this pollution by deforesting as indiscriminately as we do. So we have two evils now confronting us. And yes, even with our disposals, we do it indiscriminately. For instance, let me give you an example. I used to bring this example, and it's good for us to also look at it from different angles. When you talk about cleaning up the environment, nature had provided vultures for us to do that environmental sanitation work, which they do cleanly to be able to clear up anthraxes, botulism, cholera, and tuberculosis, and so on. But we have decimated the populations that are no longer there to help us. So that also contributes to all the diseases that are affecting us. And to even buttress it more, it's been shown that 75% of the infectious diseases that affect the humankind is actually zoonotic. That means that it is transferred from the animal population to the human population, and they are in the environment. So if you look at it, we have tampered with that with that natural balance. And again, the support system that is supposed to help us, we are not. We've also tampered with it. So on one hand, our activities are putting us in danger, and what the nature has put in place to help us is also now being destroyed by us. So we are faced with two evils.
The other thing is that a lot of what we talk about when it comes to the environment is most of the time limited to the urban centers, whereas a lot of harmful, very harmful environmental practices are going on in the semi-rural and rural areas where the bulk of the country's population resides. Taking one example is the issue of burning of bushes to create land for farming. Just to take an example of that. How much nexus is there between that and what eventually ends up killing people? Not only COVID-19, tuberculosis, and a whole host of other ailments that are related to respiratory situations.
Yeah, you see, the more, and as I said earlier, we on one hand, we are generating all these toxic substances in the atmosphere, and on the other hand, we do not have the trees that will help in curbing, in taking up these things for us. So we are clearing the trees, and as well, we are increasing the burn. So definitely it will affect us. And when we talk about the rural areas, absolutely, they are also culpable because when they clear their lands, they also deforest in their own way, and not knowing that, especially some of them lying in lowland areas or in slopey areas, they destroy the trees that supports the soil. And what that happens is that when it rains, the rain hits the ground directly and it causes severe erosion. And sometimes it even causes landslide, which destroys a whole lot of community. We see that happening every time. So if you put all of those things together, it has a way of affecting us, not just in terms of diseases, but also in terms of our livelihood and even in terms of our homes, because when these disasters happen, it clears up a whole community and is destroyed, and the diseases also follow. And like the example I give of the situation whereby we do not have vultures again to clean up the environment anytime we mess it up. For instance, when we have carcasses around, we're supposed to have vultures to do that, but when they are not around, we have dogs and rats coming around to do the cleanup. And you agree with me that dogs and rats are closer to the human population, and they bring these things to us, as you mentioned, tuberculosis, botulism, cholera, and so on, and they throw it to the human population and is affecting us. So that is the kind of thing that we cause on ourselves when we are not careful on how we relate with the environment. But these things, the environment does it very quietly and very solemnly, that sometimes we overlook the environment. And let me take this opportunity to point out that the three pillars of sustainable development, which is the planet, prosperity, and people, the planet is actually at the base of it. Before, there was a misconception and they put the planet at the top of it. No, it is not when people become prosperous that the planet will prosper. It is only when the planet prospers that is when people become prosperous, because the environment is the #1 unit of production.
Indeed. Mr. Joseph Onoja, Technical Director of the Nigerian Conservation Foundation, thank you very much for your perspective on this today. Thank you for your time.
Thank you. My pleasure always.
We'll take a break on COVID-19. When we come back, we'll take a look at yet another perspective on the environment and the possibilities with COVID-19. Please stay on with us. Thanks for staying tuned. Welcome back to our COVID-19 update. Let's talk now to Professor Babajide Law, Director, Center for Environmental Human Resources Development. Professor Law is also a professor of chemistry at the University of Lagos, and he joins us via Skype from Akoka. Good evening, Professor Law. Thank you for your time. Nice to see you again.
Good evening, Ladi. Thank you so much for inviting me, and it's my pleasure to be here.
Indeed, the environment has long been overlooked. It's been overlooked predated COVID-19, but it appears as if it's the situation with our environment is making COVID-19 worse and is likely to continue to make COVID-19 worse. People like yourselves in this sector who have made it your life's work, what can you tell us about why this is so and what we can do about it?
Well, thank you, Ladi. The issue simply is that somehow those of us in the environment thank the prime mover, the Almighty, for bringing COVID-19, because sometimes we say it's a blessing in disguise because COVID-19 has made nature to be able to thrive since the lockdown. For the environment, as you do know, half of the world population has been locked down. And this has reduced environmental pollution by about 30%, as we have data and statistics are showing us, because mobility has been reduced, interstate travel has stopped, international flights have been stopped. So all of this is a positive aspect of COVID-19. But we cannot say that all of that is good for the world or is good for nature. There have been several negative effects of COVID-19 on nature and on the environment. One key one that I want to immediately bring to the fore is the volume of unrecyclable waste that COVID-19 is making us to generate. We find that several tons of plastic waste is being generated from PPEs, from face masks, from gloves, from several different things. And all of these are creating challenges for waste managers, even locally and internationally. When we look at what is happening globally, in Singapore, for example, in the 6 months of that little town of 5 million people or thereabout, additional 2,000 tons of waste was generated. In Nigeria, it's the same thing. But we thank God that situation in Nigeria has been that waste management has been declared as an essential service. So people, all the waste managers are able to move the waste. But how about the health waste, the medical waste in the isolation centers, in the hospitals? Because every health professional now goes there with with PPE. Now, all of that PPE, where is it going to sit? Where is it going to end up with? That's the point we're trying to say, that now we need to start thinking about what we are doing with respect to municipal waste management. We should not allow these PPEs to end up at our open dump sites where they are going to be incinerated. We already know that in other climes, all the plastic waste coming out of the hospitals, out of the isolation centers, are going to be well incinerated in order that they won't affect us. I had your last question to the last guest that you had, that what's happening in the rural areas. And I want to touch on that the rural areas are being impacted by this COVID-19 environmentally. The farmers are producing tons and tons of agricultural food, most of it not being moved out, and they are ending up in decay. That waste is there, creating issues for the environment in those parts.
There's also the question of clean air. COVID-19 is a respiratory ailment, and without getting into the medical aspect of it, there is a link between clean air and the prevalence of respiratory ailments, not just COVID-19, a whole lot of others. So, again, the environment brings to bear here on how possibly this could spread. Am I right?
Yes, you are very right, Ladi. We have information. The only data available in the public domain right now is data from the Center for Research on Energy and Clean Air in China. That center has showed that since COVID-19 pandemic started and there has been a lockdown, there has been about 25% reduction in carbon emission. What that means is that we find that COVID-19 lockdown has made it now possible for us to have cleaner air. And I must let the public know that we had embarked on a study of Lagos metropolis during the lockdown. We had permission from the government to start taking spot measurements of the situation of air in Lagos, air pollution in Lagos. And we found out that during that period of lockdown, the parameters, the environmental parameters improved. Nitrogen dioxide levels got lower than what it was in 2019. Fortunately, we had some 2019 data that we were able to compare with. Nitrogen dioxide improved. Carbon dioxide emissions too improved, essentially. And NOx, which is a serious pollutant, we found that those values were lower than what it was in 2019. So one wants to say that maybe the lockdown is a better thing for the clean air of the environment. However, as the lockdown gets easing, or as the lockdown is eased, obviously cars and vehicles and that cause the pollution will be back on the road. And what that means is simply that we'll again be back to non-clean air, which is what we suffer every day. So clearly, clean air is needed, is necessary for improvements in the pandemic, because we do know that respiratory illnesses are one of the major things you see once the pandemic is on.
Indeed, quite a lot of information in so short a time. Professor Babajide Law, thank you so much. Professor Law is the director of the Center for Environmental Human Resources Development and is a professor of chemistry at the University of Lagos. Thank you, Prof, for your time this evening.
Thank you, Ladi. It's my pleasure to.
297 secondary schools across 17 local government areas in Enugu State are being disinfected ahead of school resumption next week. The Commissioner for Education, Professor Uche Eze, says the exercise, which commenced today, is expected to be concluded by Monday evening. Professor Eze says the state government has not only set up a team to monitor compliance with the NCDC protocols across schools when they resume, but has since begun expansion of school blocks and facilities in order to observe the social distancing protocols.
For over 3-4 months now, the state government has been involved in renovation and expansion of our school facilities to ensure that we have enough space for our children when they come back. For us to maintain social distancing, it is important that we have enough space, and this is what His Excellency has planned and worked. In fact, a few days ago, His Excellency himself moved around school to inspect our state of readiness. And this fumigation is going to be the last stage, because once we fumigate, our school will be completely ready for students to come back and be safe in the school.
A quick look at the COVID-19 figures, the very latest in Nigeria at this moment. The Nigeria Center for Disease Control reports that 266 people have been discharged in the last 24 hours in 9 states, including the Federal Capital Territory. Delta State leads with 102 patients discharged, followed by Oyo with 49, Kaduna with 35. The FCT has 34, Edo 14, Rivers 13, Borno 8, Ogun 7, Osun 2. That's the same figure for Lagos. Also, 5 deaths were regrettably recorded in the last 24 hours in 4 states. Edo has 2, Delta, Ondo, and Osun have 1 each. The center reported 481 new confirmed cases over the last 24 hours, putting the total confirmed cases in the country at 42,689. Total recoveries stand at 19,270, and 878 deaths have been recorded in 36 states and the Federal Capital Territory. The current number of active cases is 22,541. 5 states with high confirmed COVID-19 figures in Nigeria are Lagos with 15,043, the Federal Capital Territory Abuja with 3,710, Oyo with 2,713, Edo 2,285, and River State with 1,782 confirmed cases. Joining us to further look at the environmental factors that fuel the spread of COVID-19 and how to curtail them is the chairman of Infection Prevention and Control Unit at the Ira Specialist Hospital, Edo State. He's also a member of the Society of Occupational and Environmental Health Physicians of Nigeria, Professor Stephen Abba. Professor Abba joins us from Ira via Skype. Good evening, Professor Abba. Thank you for your time this evening.
Good evening, Ladi. Good evening, Nigerians.
The environment, as we've been saying for much of this evening, has not really featured in most of the discussions that have taken place around COVID-19. Yet, as it's now becoming apparent, it is a very, very important part of it. We've talked about the problems with my earlier speakers, but in your view, what do you make of what has happened so far?
Yeah, thank you. The COVID-19 has exposed the role of the environment in our healthcare system. And I would like to look at it from the various dimensions of the environment. We have the physical environment, we have the built environment, which will refer to our hospitals, our offices, and all that. And then also we have the biological component of the environment, which would include all the animals. We have heard about wild animals in relation to epidemics. Also, animals related to transmission of diseases to man. We have plants and so on. But one of the key elements of the environment that is often neglected is the unseen part of the environment, which is human behavior. Between
we do seem to be having some issues with Professor Stephen. It seems to, well, if we can, we'll get him back. But in the meantime, let's go outside our shores and take a report from on the continent, where the South African government is adding a fight against COVID corruption to its anti-COVID efforts. From contract irregularities to inflated contracts to seeming cronyism, the ruling ANC is facing public outcry over the emergence of what have been termed COVID-preneurs. Our South Africa Bureau Chief, Betty Dibia, has more.
Following the proclamation by President Cyril Ramaphosa last week, empowering the Special Investigating Unit to probe any cases of stealing, wastage, or mismanagement of COVID resources, the buzzword in the country has been COVID-preneurs. Names have been named in several allegations, and many people are not happy. In KwaZulu-Natal, 29.4 million rand in questionable payments of COVID emergency provisions has been recorded. In Mpumalanga province, the Hawks are looking through a municipality for alleged COVID contract fraud. There's a scooter ambulance contract scandal in the Eastern Cape. As many as 102 entities are being looked at by the authorities in Gauteng province alone. A number of officials, including the presidential spokesperson, Ms. Kusela Diko, and the MEC for Health, Bandile Masuku, have been asked to step aside while investigations continue. And the Premier of Gauteng, David Makura, is not pleased.
These allegations we are facing now have profoundly eroded public confidence in the government I have the honor to lead. At this point, I'm really disappointed to have an MEC who has been leading in this front very well, facing allegations that I can't ignore.
The list of the suspicious is growing, and the country is looking at the ruling ANC as it loses more brownie points in its kind of fight against corruption. Dr. Samadoda Figeni of the University of South Africa is a political analyst. He says the picture is worrisome.
It could be the right signal for people to step aside when they are implicated, so that they give a chance for investigation to clear them or for the law to take its course. But these pronouncements are just not sufficient. There come a time when we must be decisive, and people who have stolen to be found guilty, to be taken to prison, whether they are ministers or former presidents. It shouldn't really matter. But it is worrisome, though, that people at such high levels in government cannot understand where conflict of interest is.
2021 is the year for municipal elections, COVID permitting. The last, in 2016, proved quite disastrous for the ruling African National Congress, and its undoing was still the issue of corruption at the time. From Johannesburg, South Africa, Betty Dibia, Channels Television News.
The further easing of COVID-19 restrictions in England due to come in this weekend has been postponed for at least 2 weeks amid concerns over an increase in COVID-19 cases. UK Prime Minister Boris Johnson says progress against COVID-19 continues, with daily and weekly numbers of deaths falling, but warns that some European countries are struggling to control it, and the UK must be ready to react.
Cannot be complacent, and I won't stand by and allow this virus to threaten to cause more pain and more heartache in our country. So that's why last night the Health Secretary announced new restrictions on household contact in the Northwest, specifically Greater Manchester and in parts of East Lancashire and West Yorkshire. Our plan to reopen the society and the economy is conditional, that it relies on continued progress against the virus. With those numbers creeping up, our assessment is that we should now squeeze that brake pedal in order to keep the virus under control. On Saturday, the 1st of August, you'll remember, we had hoped to reopen in England a number of the higher risk settings that had remained closed. And today, I'm afraid we're postponing those changes for at least a fortnight. That means until the 15th of August at the earliest, casinos, bowling alleys, skating rinks and the remaining close contact services must remain closed. Indoor performances will not resume. Pilots of larger crowds in sports venues and conference centres will not take place, and wedding receptions of up to 30 people will not be permitted. But ceremonies, of course, can continue to take place in line with COVID-secure guidelines.
Vietnam has recorded its first COVID-19 fatality in a devastating blow to a country proud of its zero deaths status. The first man, who was aged 70, was from the central city of Hanoi. A second death of 61-year-old man was reported later in the day. The country, which has a population of around 95 million, has just reported 546 cases since the pandemic began. Unlike many countries, Vietnam acted before it even had confirmed cases, closing its borders early to almost all travelers, except returning citizens. Here's more in our COVID-19 Global Update.
Vietnam reported 45 new coronavirus infections in the city of Da Nang, the single biggest rise in cases since the start of its outbreak. It has also confirmed the first death from the virus. The country had had extraordinary success in keeping the virus out after shutting its borders early and imposing strict quarantine and contact tracing. But a new outbreak in Da Nang, a tourist city on the central coast, has caused alarm, as the origin has not yet been identified. The president of the Philippines has extended lockdown restrictions in the capital Manila, saying they will remain in place until mid-August. President Rodrigo Duterte made the announcement in a televised address that was pre-recorded and released on Friday. He is also promising free vaccines if they became available, prioritizing first the poor and then the middle class, police and military personnel. Brazilian President Jair Bolsonaro has said he was taking antibiotics to deal with an infection that left him feeling weak, chuckling in an online video about a mold in his lungs after he left isolation due to a coronavirus infection. The president tested positive for coronavirus on July the 7th, but has since been given the all clear. However, his wife, First Lady Michelle Bolsonaro, has tested positive for the virus.
Before we go, some cheery news from Ebonyi State, where Governor Dave Umahi has tested negative for the COVID-19 virus. The governor confirmed this in a statement, noting that his daughter and 3 of his close aides have now also tested negative for the virus after further tests were carried out on their samples. He thanked God for the recovery and the people of Ebonyi State for their prayers and support. The governor had on July the 4th announced that his daughter and some of his aides had tested positive for COVID-19 and had gone into isolation in line with NCDC protocols. And speaking of survivors, the World Health Organization, in collaboration with the Yobe State government, has called on survivors of COVID-19 to support the campaign against the spread of the disease so as to reduce community transmission. The WHO program manager in the Northeast, Dr. Collins Owili, who was represented by a public health officer, Dr. Ibrahim Salisu, made the call in Damaturu, the Yobe State capital, while celebrating patients who recovered from the disease.
Yobe is one of the states with the least cases of coronavirus in the Northeast sub-region. According to records made available to Channels Television by the COVID-19 committee, the state has recorded 66 confirmed cases, 54 discharges, 9 deaths, with only 3 active cases. The World Health Organization, while commending partners for a job well done, says celebrating the survivors will give hope to those who may contract the disease, as well as energize the organization for a greater task ahead.
COVID-19 is one of the diseases that characterized with stigma. People don't want to associate with a victim or someone who has suffered from COVID-19. So for people to come out to give testimony, I think it deserves to be celebrated.
Survivors who narrate their ordeals of discrimination and stigmatization appeal to residents of the state to take adequate precaution to protect themselves.
We are here to celebrate with the state government because they have recorded remarkable achievements and milestones in the COVID-19 control efforts. Although we recognize that we still have some way to do, and we are continuing in the COVID-19 control effort. We are not relenting in that aspect.
I felt bad when I contracted the disease, thinking my life has come to an end. But when I received counseling, my hope was rekindled. I was encouraged by my co-health workers. As for me, I did not pass through any stigmatization.
The World Health Organization had earlier donated education materials and conducted training to health workers on COVID-19 prevention and control in the state.
Wearing a face mask properly covering your nose, mouth, and chin is one of the very best ways to prevent yourself from catching COVID-19. You can also take a close look at some of the COVID-19 global numbers in real time by logging on to our website, channelstv.com, You'll get more updates and better understanding of all you need to do to stay safe and alive. Also look up COVID-19 cases, figures, and numbers of recoveries in Nigeria, Africa, and around the world. You can also find the latest in stories right across the spectrum, from business, sports, to entertainment, health, and then, of course, politics. That's our package on the COVID-19 update program for today and this week. Do join us at noon, 6 p.m. and 9 p.m. on Monday next week. Thanks so very much for watching. I'm Ladi Akridoluale. Have a good weekend ahead.